Hey everyone, welcome back to Feature Fridays, where I highlight a fascinating case from my clinic. I'm Dr. Anna Lafian, board-certified rheumatologist. I know this gets heavy in the medical lingo, so if you have any questions, please drop them in the comments and I'll try to clarify. So I saw a 70-year-old female who presented to me for an elevated CK, which is a muscle enzyme, and progressive muscle weakness. She told me that she had been having muscle weakness for the past year, but it was progressively getting worse. She was having difficulty with walking, going up the stairs, standing from a seated position, especially if the chair or couch was pretty deep. And then she started having muscle weakness in her upper shoulders as well. She was having some episodic shortness of breath, but she denied skin rashes, joint pain, joint swelling, fingertip wounds. And she had been taking atorvastatin for several years before the onset of her symptoms. On initial evaluation, as a way of testing her muscle strength, I asked her to perform a squat, and this lady nearly fell back. It took me and two of my medical students to stand her back up. And that day I was pretty convinced of the diagnosis. I ordered a myositis panel and an HMGCR antibody, and I started her on 60 milligrams of prednisone. Upon follow-up, her HMGCR antibody was very high, and this cinched the diagnosis of necrotizing myositis, which is a very, very rare and severe form of muscle damage linked to statin use. Its estimated occurrence is in only 2 to 3 cases out of 100,000 statin users. I give this information in order to point out how rare it is. Statins are necessary for a lot of patients, especially high-risk cardiac patients, so please don't stop your statin because you're hearing this. Please talk to your cardiologist if you're concerned about muscle symptoms related to your statin. And also remember that muscle symptoms are very common with statin use, but that doesn't necessarily mean that muscle aching equals myositis. I also wanted to highlight this case because May is Myositis Awareness Month. And the great news is that my patient has been doing excellent on IVIG treatment. She has gained all of her muscle strength back. Her muscle enzymes, the CK and aldolase, have now normalized, and she is already off prednisone. So I hope this was an interesting teaching case, and I will see you again soon. Take care. Bye.